So ice or heat, that's always the debate. I've had patients over my last 22 years of practice here as a chiropractor always asking me, what do I use, heat or cold? Or they'll come to me, they said, they sprained their ankle, etc., or they've hurt their back, it's really strained, and they've been using heat, and it's kind of helping, kind of not helping. Those sorts of things really, really bother me because it's really important that you know when to use heat and when to use ice. Because if you use it too quickly, heat can actually be damaging. It can actually harm you. And so you don't want to be using heat at the wrong time. So let's talk about when to use ice and when to use heat. Again, the age-old question. So let's think about the journey a client takes. So as you know, at Intelligent Health Group, Dr. Bajaj and I have created a 3-step signature system where we take you from illness and inflammation through different stages of healing to greater health or well-being. So again, it can be thought of as your initial acute phase, where an injury just happens. There's like an illness, an injury, and you get inflammation at that point, maybe some swelling and so forth. That's your acute phase, okay? That lasts anywhere from 4 days to 7 days, depending on the extent of the injury. At that time, it's very, very important that we bring inflammation down. In that second stage of care, where there's more healing involved, and now it's about improving the function back into the body, make sure you can start doing things better, decreasing tension and just general stiffness in the body, and trying to restore more of that proper functioning in the system. That's where it becomes really important that we determine a way to facilitate that improved circulation, okay? And in that last stage, if things are really chronic, we just want to find ways to make sure that you maintain as good a function as possible. It's about maintenance. It's about making sure that we're optimizing ourselves. So acute, subacute, chronic is another way of looking at it as well. So in the acute phase, as mentioned, when we bring inflammation down, the thing that's most important is that you use ice. Okay, so you definitely want to be using ice at that point. What does ice do? Ice is called cryotherapy. Ice, when applied on an injured area, on an injured, inflamed area, will help constrict the blood vessels in that area. So there's less blood flow getting out, and hence less liquid, less fluid, and there'll be less swelling. So you'll be able to contain your swelling, contain that injury, okay? You'll also notice when something is originally strained or sprained, it feels hot. So again, you can just think of trying to cool it down. So cooling it, reducing inflammation and swelling. Also, it will really be good at numbing the pain. If you've ever been outside, you know your hands get numb, your feet get numb. Well, this can work in your favor in this case, right? Because you don't want to feel the pain. You want to kind of numb that area. So reducing circulation from there, so the nerve endings aren't, getting as much of that blood supply, will actually make you feel a bit of anesthesia, a bit of numbness to the pain. So that's really, really important, that stage 1 care. Now, when we get to that subacute care, after 4 to 7 days, where things are still painful, but not as painful, but you're stiff, and you're in between that phase of being, in some significant pain and just being stiff and tight, that's where actually it's really interesting. You can actually use an alternating system where you're actually going to do ice and heat in alteration. So what I would suggest in that situation is you start with some heat on the area. It's going to help relax the muscles. So it's going to do the opposite of what I just talked about. It's going to open up the blood vessels. It's going to bring circulation to the tissue. And as you start applying heat and maybe even doing some motion and movement in that period to the injured area, you're going to feel an increase in range of motion, okay? Less stiffness, less tension. And then, of course, so because maybe there still is pain and there's still maybe some swelling there under the surface, some inflammation, that might get aggravated by that heat. So right there and then, to immediately then strap on an ice pack for that time being will really help to bring that inflammation down. So then you get the best of both worlds. You're getting the anti-inflammatory effect and that initial effect from the heat to improve your range of motion. How long do we do these things? So in that first phase I talked about when we were using the ice pack on the injured area, you want to be applying ice at least 15 minutes in the beginning. And you could do it every hour. You don't want to do it anything more quickly than an hour. And you don't want to be going any longer than 15 minutes, for example. If you do it too long, some people say, hey, I had pain, I strapped the ice pack on and left it there for 30 minutes. Or I left my heat pack on for too long. Doing things for too long and not following the recipe will also be hazardous. So you only want to do 15 minutes. You don't want to be doing more than that. Leave an hour gap in between. Otherwise, the body's going to do something called a Huntington's response. It's actually going to get upset that it's being iced down so much, and so the body's to try to maintain homeostasis or balance is going to kick in into its system a means to actually warm that area up, and it's going to try to do the opposite. Okay, so we don't want that Huntington's response. So 15 minutes, leave 1 hour break, then ice it again. And I always tell my patients, do it as many times as you can, okay, through the day, whatever's possible. If you have ice packs like this that we have in our clinics, you can just keep it in the freezer at work even, one at home, and just take it out, strap it on, put it back in the freezer, and then take it out again in an hour and keep applying it as needed. And that'll definitely help speed up that initial inflammatory phase. In that second phase, where we're alternating the ice and the heat, I would say do 10 minutes of ice, and then do 10 minutes of heat and immediately do 10 minutes of ice. And by alternating that and ending with the ice component, then you'll have less inflammation and better range of motion. I would just alternate once, 10 minutes and 10 minutes. Again, wait an hour, and you can do it again. That same thing, keeping an hour gap would be good. In that last stage, where now you've gone beyond the week. Now maybe you're at the 2 week or 3 week mark, and now really there isn't really pain. It's just stiffness and tension, more of a dull ache, a soreness, that type of thing. For that, you want to use heat. So using a heating pad, an ice pack like this that you can actually put into the microwave, so it serves as a 2-in-1, and you can warm this up for a minute and a half in the microwave. It becomes a hot pack. Wrap it in a towel and put it over the area. That would be the best thing, because gel packs like this have a moist heat effect in the body. Just using a heating pad is not good because it's dry heat. It doesn't penetrate the skin. You want moist heat. So even getting a towel, wet the towel nicely, liberally, and then putting it in a microwave for 30 seconds and putting that on, like they do in spas, that's moist heat. That's going to be really good. Or lying in a hot bath, ideally with a cup of Epsom salts. 1 or 2 cups of Epsom salts in a hot bath, especially when you're just tight, sore, achy. That's immediately going to help pull out any inflammation from your body, toxins from the body, and help rejuvenate the tissues. So immersing yourself in hot water would be the best, because that's the best of moist heat. Otherwise, using gel packs like this or those towels. So that's the best way to use ice and heat. Ice originally, bringing inflammation, acute pain down, numb the pain. Then alternating, if you would like, from heat originally and then ice. And then lastly, later in the stages of healing, to make sure you're using heat. So that is how you have to think about it. Now, aside from the hot and cold you get from gel packs and from being in the bath and your towels, you can also use these. These are pain gels. And we're very happy with this product right now that we have in our clinics, Sombra. So Sombra I was talking about earlier today with people. We got this up from the US. Still not a lot of clinics have this. And it has such a good texture to it. It doesn't, leave much of an afterburn, etc. It has natural anti-inflammatory and pain relieving, muscle relieving properties, all herbal, and so there's no side effects from it. So you can use it as much as you want, as needed, and this will also aid. So in addition to the hot and cold packs, you could be using pain gels. And sometimes people overlook these things. They go right to medications, etc. But these are inexpensive things you can do that can really help speed up the healing. If you're just doing it, regularly, right from the outset of an injury, it really, really is helpful. If anybody has any questions about hot or cold or what's best for you for your specific condition, please let me know. The only contraindications I will say is if you have any sort of sensory issues, you can't feel things very well, like maybe if you have a certain type of diabetes or rheumatoid arthritis or things where, or peripheral neuropathy, where you just don't have the right sensation, you don't want to be doing heat or cold too long because you might actually get burns, either frostbite or an actual burn, because you can't really feel the temperature. So just keep that in mind as well. I don't want to forget saying that. But please, any other questions, we're here for you. You can always call any of our providers in our clinics for a free consultation about your specific health condition. We can talk much more in detail about what therapies and other options there are to help you, aid you in your pain, and so we can take you from those three steps from illness through healing and hopefully to that greater level of health, which is our commitment. If you're interested, please do take advantage of our $49 offer right now for a complete initial assessment and treatment with any of our providers. Physiotherapy, chiropractic, spinal decompression, naturopathy. We're here to serve you. Thank you.